I'm Dr. Sri Nagesh from Ojas Aesthetic, Hyderabad. Today we shall discuss about breast augmentation for cancer survivors. Cancer survivors are those individuals who have undergone, mutilating surgery to the breast, that is, removal of the breast, maybe with or without removal of the axillary lymph nodes, depending on the stage of the surgery, and would have most likely undergone chemotherapy as well as radiation. There are two options for a breast reconstruction. One is a surgery performed immediately after the mastectomy or a delayed reconstruction. So, an immediate reconstruction is when a mastectomy has been performed. At the same session, you also perform a reconstruction. And a delayed reconstruction is a surgery performed months or a few years after the cancer treatment is completed. So, what are the options for augmentation and reconstruction? That depends on amount of breast that has been removed and the amount of skin that is available for reconstruction. If only the breast volume has been taken off but the skin has been preserved, then a silicone implant can be used to recreate the breast mold to give the natural feel. Here you have two situations. One is a single stage where the breast silicone implant is placed immediately and the procedure is complete, or second is a two-stage approach where a tissue expander is placed to stretch the skin to make room for the implant, and after an adequate room has been made, then the expander is removed and replaced with a permanent implant. The second is an autologous reconstruction, which is done by fat transfer, where fat is harvested from another area of your body, especially the abdomen or the thighs, to recreate the breast. So this can be also combined with implants for enhanced volume and contour. The third is a hybrid techniques, where you combine both implant as well as fat to give a more natural looking results. The fourth thing is way of augmentation is by use of tissue from a remote area into that particular area, especially when there is a lot of volume loss as well as skin loss, to replace all this tissue to give you a more natural and enhanced look. So what are the considerations that are necessary for cancer survivors before undergoing surgery? One is radiation, the effects of radiation therapy. Radiation, as we know, it can affect the elasticity of the skin and healing. It also can potentially impact the success of the implant placement. Second is, the surgeon may also recommend techniques such as autologous reconstruction in case of significant radiation damage. Because when there is a lot of radiation damage, there is a very poor blood circulation to that area, and the skin does not stretch, is not elastic and does not stretch as desired. So there could be wound healing problems. Because of that, we have to make other considerations. Breast augmentation after cancer therapy is whether the patient has completed the treatment and is under a regular medical monitoring. If these two are not there, then it may be risky to go ahead with the breast augmentation procedure. So, what are the things to consider? You have to consider how to correct asymmetry and try to achieve symmetry with the other breast, existing normal breast. Why should you get these things done? Because it is as much about getting rid of the cancer. It also, breast reconstruction is about emotional healing and physical restoration. So it is very, very important that you choose the right surgeon and the right procedure before undergoing this particular procedure. If you have any queries, you can approach us at our clinic, Ojas Aesthetic, at Madhapur, Hyderabad, or contact us on 95151 06591 or visit our website www.ojasaesthetic.com.